Hello, everyone. This is Dr. Angela Natoli of the Chiropractic and Functional Neurology Center. I am speaking with Dr. Karla Mehlenbacher, again from the Giraffe Cafe. Dr. Karla is a chiropractor, and she also practices functional neurology and functional medicine. And today we are going to talk about primitive reflexes and what that means if you see these things in your children, and how you can quickly assess if your child may have some difficulties in development and may need our help. So Karla, I'll let you take it away. Which one would you like to do first?
So I'll do the main 5. There's really a main 8, but we'll keep it short. So the Moreau is one of the most common. A lot of people are walking around with this as an adult even. So this is where it's called the startle reflex, when you have that sudden movement and jolt. This is where you see things like hypersensitivity, sensitive to sound and light, easily distracted, screen time issues, the blue light. So that one is a very common one to test at home. You can check it by doing starfish and seeing if they can cross over, or the startle with the clap. The other one is a rooting. So this is when the baby is actually going towards the breast. So you want to scrape from the cheek down towards the mouth. And what you're looking for is any movement in the lip. So if the kid still has this, a lot of times you'll see picky eating, fussy eating, finger sucking, poor articulation with their speech. The palmar, which I mentioned in the last one, but this is the grasping reflex. So what you actually test is you scrape their hand, and you can use like a paintbrush or a pencil, but you want to actually press to where they can feel it. And what a positive sign is kind of curling in of those hands, or those fingers. And this is an indication typically of poor handwriting skills, poor fine motor coordination, mouth and tongue movement with writing. So if you see your kid doing like when they're trying to write, really focusing, that's an indication that might need more integration. The asymmetric tonic neck reflex is super common. This is what actually is activated when the baby exits the birth canal, because it makes their head have to turn and then they make their way out. So it's the first head turn. It's what we do as adult. If adult has it, it's common when you can tell when you turn your head and you turn your steering wheel with it. So it's the ability to separate our body from our neck. So I can turn my head and my body stays still because I know where I am. Whereas if a kid has this, they'll move their whole body with their head. So a way to test is on hands and knees is typically first. You turn their head, and if they have like a bend in the elbow, that's a positive indicator. Or standing, you can test as well, where they just hold their hands straight out. You're behind them, and you turn their head, and you see if they can keep them straight out. If they can't, you'll see this. Right. That one is actually present in about 50% of dyslexic children. The Spinal gallant is where you scrape their back and they curve into it. So if you've ever held a baby, you see they like curve into wherever you're holding. This one is present in kids that are bedwetters, often have poor motor control. They slouch in the chair all the time. They can't hold their posture. I'll do one more. The symmetric tonic neck reflex. So this one is actually one of the most common findings in childhood neurodevelopment. So you really test best with hands and knees on the tabletop, and you have them flex their head and hold, and then flex their neck down and hold. And what you're looking for is a shift in their body. So if you've ever seen a baby, they'll just plop right back down on their heels, right? Or they fall forward. Mm-hmm. So if you move the head up and down and you see that they're getting this movement in their forward or back, then that's a positive reflex, and that's an indication that they might need integration. And of course, the treatments and therapies for this are specific to that person because it is complicated. It's a network of integration from the ears, the eyes, proprioception, chemicals. So I don't typically like giving cookie cutter answers for treatment, but it's more of a window into saying, why is this reflex still present? And what can we do to make this integrate better into where their brain feels safe and they can move on to that next level of movement and cognition?
So some of those are more complicated and some of them are easier for parents to do. A parent can, do that to their kid and watch for any mouth movement. A parent can do this, you know, just kind of scrape along the palm, like Dr. Karla said, and watch for that grasp reflex. Some of those are pretty simple things that you can do at home. And again, not that it's diagnosing or doing anything major at home, it just may be an indication that we could help, essentially.
Right, and there are timelines on this. So there's certain times where it's actually appropriate for that baby to have that reflex. And then
Absolutely.
most of these are completely integrated by about 2 years old. So if you're checking these on 2 and above, there are some, you know, depending on the kid, because you can't put everyone into the same model, but when you get them to be a little bit older, then you start to say, okay, you know, they're in grade school now and they're still having this reflex, then I want to dig a little bit more into this. But if you want to be way ahead of the game, as soon as possible, get these kids doing these basic exercises to help get them to that next level even faster and faster.
So some of the symptoms a parent might notice in their kid would be bedwetting, inability to shut out almost sound, things that would be normal to most people, normal light, normal sound is kind of agitating to them. Inability to hold pencils, kind of like, what else did you say? Squinting when writing. What other symptoms can parents look for?
Inability to sit in a chair.
Yeah, absolutely.
Still, inability to tune out external stimuli from sound. A lot of that is that they can't perceive low frequency sounds appropriately, so they're constantly perceiving like predatorial type sounds, and there's no way you're going to tell them to focus on what's in front of them.
Yeah.
But
So
also just recognizing that this is common, and it's not that kid has a behavior issue necessarily. It's just that their body's asking for something else a little bit more right now, and then the behavior comes after.
yeah,
Reflex, gross motor, then fine motor.
absolutely. So just a few things your parents of children at home can check on your kids, or if you're noticing any of those symptoms, those would be great jumping off points to reach out to someone who studies functional neurology. So Dr. Karla, thank you again for the tips at home, and until next time.
Bye.
Bye.